As we discussed, sir, what kind of diet plans and exercise that we can do for this?
Yeah. So exercise, if I say minimum 2 hours of walking every day is required. Minimum 2 hours of walking. So less than 2 hours is of not much help in case of polycystic ovaries. So 2 hours of exercise, it has to be rigorous. Some patients will go to the gym also to do exercise, but that is okay. Irrespective of gym and all, at least 2 hours of walking every day, if you do regularly, then the chance of ovulation is high and to get the pregnancy is high. Then regarding the diet plan, what you have to do is you have to avoid carbohydrates and sweets and chocolates and ice creams. All those things has to be avoided. And try to avoid this Chinese food items because they add Ajinomoto, that is not good again for the pregnancy. So these things has to be avoided. So no carbohydrate, high protein diet is the best thing for getting pregnant and for better ovulation.
سألته عن نوع النشاطات التي يجب علينا أن نمارس لكي ننتج البيضة الصحية. قال إننا المشي ساعتين على الأقل. هذه تجعل الجسم ذات حيوية قيمة. وأيضا إذا أردنا أن نروح إلى مراكز اللياقة البدنية هذا أحسن، وإن لم تكن المشي ساعتين على الأقل، والابتعاد عن المأكولات الصينية والمأكولات السريعة لأن فيها مواد ضارة للجسم، وأيضا أن نبتعد عن المأكولات الصينية والمأكولات السريعة لأن فيها مواد ضارة للجسم.
Now we will discuss about other conditions. Okay, so now one of the major things we see is endometriosis. So endometriosis is a condition where there is cyst in the ovary, but more than that, the cyst, the ovary, the tube, uterus, intestines, bowel, everything will get stuck. So when it gets stuck, even though ovulation is happening, the tube will not be able to take the egg, and then pregnancy won't happen. The incidence of endometriosis is even as high as 10 to 15%. So that is increasing. That is because the pregnancy is getting delayed. So whenever the pregnancy is getting delayed, the endometriosis is coming up. So that it is difficult. For these patients, it is difficult to get pregnancy once they get endometriosis. Not only the cyst, but also the adhesions, the stuck, everything gets stuck. The adhesions becomes a problem for infertility.
بسبب الكيس في عنق الرحم، هذا يسبب الانسداد في الأنبوبة في الرحم، وفي هذه الحالة يجعل البيض لا تتحرك من الرحم. يعني في هذه الحالة يسبب الالتصاق الأعضاء الداخلية مثل الرحم والأنبوب وقد لا تعمل أحيانا.
So how to correct endometriosis? So there are medicines, tablets and injections to correct endometriosis. So when you take medicines, the chance of pregnancy is less. Means once you stop medicines, again the endometriosis will come up. So if you are diagnosed with endometriosis, it is better to undergo a laparoscopic surgery, clear the cyst, clear the adhesions, and then try for pregnancy as soon as possible. And don't waste time, because if you are not getting pregnant for next 1 year, again this endometriosis is going to come back, and then it becomes even more difficult to get pregnancy.
أحسن وسيلة وأحسن طريقة لابتعاد عن هذا المرض هي العملية الجراحية المنظار. يعني حتى إذا أخذنا الحبوب والأدوية المناسبة لهذا المرض، لكن المرض يعيد إلينا مرة أخرى بعد سنة. إذن العملية الجراحية أحسن وسيلة لهذا، ولازم علينا أن نحاول الإنجاب تلو الانتهاء من العملية الجراحية.
Endometriosis is a condition where there is recurrence. Means once you, like I have told you, do surgery and then try for pregnancy. But some patients, they may not get pregnant, maybe because of so many other factors. Okay, but when pregnancy is not happening, again endometriosis can happen. But again doing repeat surgery for endometriosis is not advised. Okay, so and then if you are again getting endometriosis after surgery and not getting pregnant, it is better to undergo IVF. IVF will improve your chance of getting pregnancy.
بعد هذه العملية إذا عادت المرض مرة أخرى، لازم علينا أن ننتقل إلى التلقيح الاصطناعي. هذا أحسن طريقة حتى ننجب.
Now there are other cysts for the ovary like dermoid cyst, mucinous cyst, symbol cyst. The symbol cyst sometimes it will reduce in size, but if the cyst is not reducing, that side ovulation will be less happening. Means pregnancy chance will reduce. Whenever there is a cyst and ovulation is not happening, it is better to undergo laparoscopic cystectomy, that is removal of the cyst and then try for pregnancy.
وهناك أنواع كثيرة من أمراض الكيش في المبيض. هذه أنواع متعددة، لكن الحل الوحيد، الحل المناسب لهذه المشاكل إزالة الأكياس من المبيض حتى تكون المبيض ذات قدرة عالية في التبييض.
This dermoid cyst is a peculiar cyst where you will have hair, fat, sometimes parts of bone, like that, you know. So the problem with this dermoid cyst is that the ovary can get torsion. Means ovary can twist itself. When the ovary twists itself, then sometimes some patients will lose that ovary because of no blood supply. Actually, we have found surgeries where we can do conservative surgery. Means we can retain the ovary, remove the cyst, and then save the ovary. So we do those type of laparoscopic surgeries.
وهذا النوع من كيس المبيض يسبب التواء المبيض، وهذا أمر خطر جدا. وهذا الحل لهذا عملية جراحية لإزالة الكيس نهائيا، وعن طريق عملية المنظار يمكننا أن نحمي الرحم والمبيض وجسم المرأة. So what are the problems of uterus that leads to infertility?
Yeah, so around 30 to 40% of all females have fibroids. So fibroids are one of the biggest cause of infertility. So 30 to 40% means 1 in every 3 females will have fibroids. So we will not know if they have fibroids or not. We have to do scan. Then only we will come to know if fibroids are there or not. Some patients will have bleeding. Then we will do scan. Then we will see fibroids. Some patients will have pain, and then we do scan. We see fibroids. But if they don't have these two things, and then some patients can feel that something is growing in their abdomen like a baby, then we do scan and then we see fibroids. Otherwise, when they come for infertility treatment, when we do scan, we see that they have fibroids.
وهذا سبب آخر لعقم النساء، هذا كيس الأليافي. وجود الكيس الأليافي في مبيض المرأة هذا سبب كاف لتكون المرأة عقمة، يعني إنها شيء تنمو في بطن المرأة، بعض الأحيان تطلع بصورة الألم، بعض الأحيان نزيف الرحم، يعني يطلع الدم من المرأة. يمكننا أن نكشف أو نفحص عن طريق الأشعة ونعرف ما هي المشكلة ونجد الحل المناسب لذلك.
Any fibroid which is growing inside the innermost part of the uterus, means where the period is happening, any fibroid growing there has to be removed, because that is where the baby is going to grow. And if fibroid is there, baby is definitely not going to grow. So you have to remove those fibroids. And some fibroids will be inside the uterus. All those fibroids it is better to remove. And for a patient who has not got pregnant, means they are having infertility, laparoscopic surgery is better than open surgery for conception.
من اللازم أن نزيل هذه الأكياس الأليافية من رحم الأم، لأن هذا المكان هو الذي ينمو فيه الطفل. لذا إزالة هذه الأكياس تجعل الطفل ينمو بشكل جيد في رحم الأم.
Sometimes there will be polyp inside the uterus that we can do hysteroscopy. That is, without doing any cut in the abdomen, we can go into the uterus and then see the polyp, then remove it. So that the pregnancy chances are high. It's called polypectomy, hysteroscopic polypectomy. Even hysteroscopic fibroids we can remove. This going into the uterus by keyhole.
وسبب آخر، الحبة الصغيرة في رحم الأم، يعني رحم الزوجة، تسبب عدم نمو الطفل في رحم الأم. عن طريق العملية المنظار يمكننا إزالة هذه المشكلة نهائيا بدون أي جراح في بطن الأم.
Some patients they undergo abortion, early pregnancy, or during up to 15 weeks or 20 weeks. Okay, so one of the major cause of abortion, sometimes if the uterus is having problem, it is called septate uterus. Okay,
septate uterus.
Yeah, uterus usually should be like this inside, but some uterus will have inside bulge like that. Okay, So when this bulge is there,
Mm.
actually in this area the vascularity, the blood supply is less.
Mm.
So we have to correct it and make it like this,
Mm.
normal.
Mm.
So when the uterus becomes normal, there's a high chance for getting the baby.
Mm.
Or else what happens when the baby gets stuck to this part,
Mm.
then blood supply is not there,
Oh.
and then it goes for abortion. So we do a scanning, and then we can come to know this is called septate uterus or subseptum or bicornuate uterus. All these things can be corrected by histolaparoscopy, and then they can get a baby.
المشكلة هذه يعني التورم في الرحم، يعني نعرف أن شكل الرحم تكون في شكل هكذا، بعض الأحيان يكون هناك التورم في بداية الرحم، وفي هذا السبب الطفل لا يستطيع أن ينمو في رحم الزوجة، يعني رحم الأم. عن طريق الفحص من الأشعة يمكننا أن نعرف هل الأم تعاني من التورم في الرحم أم لا. إذا اكتشفنا هذه المشكلة يمكننا أن نجري عملية منظار حتى نجعل الرحم في حالتها الصحيحة.